Good morning. It is now 28 days later. I promised that I would do this when I did a 14 days later data update. Now it's been roughly 28 days since the social distancing started in the Seattle area. And so I want to look at the data, see how we're doing, and think about what this means for the future. We've clearly reduced some risk. There's still a few signs out there that give us pause for worrying. But I want to emphasize that we've got actually a lot of good data. As usual, we have two things that are good and one thing that's bad. But I'll take that over the opposite any day of the week. So 28 days after we've sort of started as a community socially distancing in the Snohomish, King County areas of Seattle. Again, the most important thing, remember there's three kinds of data, strengths and weaknesses for each. Cases, hospitalizations, and mortality. I'm going to show you examples of all three of these, and again, one of them is bad and two of them are good. Let's start off with the bad news. Let's get that out of the way. This is the hospitalization for Snohomish County residents. Again, it's the only window that we have on a daily basis because King County does not report this. And you see that that line's continuing to go up. It looked like it had plateaued for a couple of weeks, around 60 to 70. Now it's all the way up almost to 100. So the hospital is more full with COVID patients than it has been for any time since I've been collecting this data. With that said, there is indications already that this is something that the hospital can handle. Back when they were at about 60 to 70 patients in the hospitals in the county, they said that they were close to capacity and they were adding more capacity. So I presume that these patients are within that capacity. I don't know exactly where that added capacity is, but let's hope that we have a room for a couple dozen more COVID patients. And again, I don't know the ratio of how many of these patients are in the ICU. A minority of them end up in the ICU, but when they get there, they stay there for a long time. The fact that this number is not going down yet may be an indication that that's going on. Okay, with that out of the way, though, that is the piece of bad news that I have for you. Most of the other pieces of news that I have for you are at least partially good. In fact, this was actually published this Sunday. It's about the whole state rather than just Snohomish County. And it's about hospitalizations of patients with COVID-like symptoms. This is new hospitalizations, so we don't know exactly how long it continues. But these numbers, however I interpret them, these numbers are lower than I would have expected to be on the worrisome end. So these are on the non-worrisome end is what I'm saying. And also, if you go week by week, newly hospitalized patients went up in Washington until you got to the week ending March 28th. They actually went down significantly. And so that's good news. I'm sure that they've probably popped back up again. But this is lower than I was worried about. And so that's a good sign. The case-by-case data, again, it's problematic because testing has been so scattershot. But at the same time, it's the best way to compare region to region. And it's very clear that what's going on in the Seattle area is much better than what's going on in some other areas of the country. So here I've done my case-by-case graph. And again, you don't need to understand too much about this graph, except that I think it's simple and elegant. Up is bad, down is good. And you can look for the color of each state's line. You can see New York and New Jersey. Eventually the virus doesn't recognize the border between New York and New Jersey, so I want to sort of look at them together. And I've made them both gray, and you can see that those are hugely up, and those are up beyond any other state in the Union right now. I've looked at a handful of other states. I added Michigan because that was pointed out to me as a hot spot, and you can see Michigan in the pink triangles is really zooming up there. It's almost as bad as New Jersey, but nothing's as bad as it is in New York State right now. So they're the ones who need help, and we need to focus as a country. If there are places where we can have capacity and can provide them help, let's find the ways to do that. They're going to be hurting right now, and they're going to be hurting for a long time to get over this huge caseload. Louisiana also is getting up there. The purple dots are a little bit hard to see, but you can see a little purple dot peeking above that high pink triangle. So Louisiana looks like there's something going on there. California, as a big state, notice that it's going up, but it's not going up as much as those other states. Florida also going up, worrisome, but not as worrisome, not going up as far as Michigan or Louisiana. So I put these on sort of yellow alert type areas. And in fact, I know that there's capacity in at least Bay Area hospitals right now for COVID patients. California is still waiting for a surge. Each day that goes by without a surge is, in my opinion, good because there's been no surge. And also notice the green line at the bottom, Washington state cases. Not only is that not going up as much, but it's actually sort of flattened out. Remember, there's a lot of noise in this data, the way that I'm doing it. But you can definitely see that there's a difference. In fact, let's zoom in a little bit more, because if we zoom in on these other states, we can try to say, where are the states that look like they need the most help right now? And again, pink triangles, Michigan, purple circles, Louisiana, need a lot of help. California, Florida, still worrisome, but not as worrisome as the other two that I just mentioned. And Washington even is flattening out, and that's by a whole state-by-state basis. So what do we do when we talk about the different countries? So I plotted the U.S. on this graph, and you see that the U.S. line is dominated mostly by that huge epidemic explosion in New York State. And the U.S. line has gone up. This is not corrected for per capita or anything like that. This is just straightforward number of cases versus number of new cases. And I wanted to plot the Italy line for cases on that. Notice that the Italy line is now going down. There's some signs that we are past the peak in Italy, and you see how it's going down. It's, taking a long time to go down, but at least it's going down. And in fact, if you look at the way it's going down, it's a little bit like what's going on with the Washington, King County, Snohomish line in the light green right there. All along I've said that we want to follow the pattern of South Korea as far as cases go. And in the case data, it looks like that we are going down like South Korea went down. And I wanted to do the same thing, again, for the other kind of data that we haven't talked about yet. We've talked about cases, hospitalizations. What about deaths? It takes weeks for the deaths to accumulate. And also, the death data is also not reported right away. You've got to realize that this data is noisier because sometimes it takes a couple days for the death to be reported in the system. With all that said, it is a very clear indicator of where we need to send help. And New York, of course, is a line that is right along the line of Italy. If you heard about what's going on in Italy, and if we're worried for and praying for them, then we have the same kind of thing going on in New York and New York City. So that's the bad news. The good news is that not every state is reacting like New York. And from this data, I think that not every state is a threat to follow the exact same trajectory. California, you see, is, as far as deaths go, it's off that line. Washington State, also off that line. The dark green is the whole state, and you see that that's even sort of flattening out. Noisy data, right? But I think you can say over a week it's been essentially flat with a lot of noise, which is really good because we want to start to pull that down like South Korea did. You see that South Korea hovered at a flat part of the line for about a week before it started to go down. And so hopefully, again, this will start to go down. We're keeping an eye on it. The news from Washington State is good in this measure as well as from the cases. If we zoom in to get a little bit of a closer look, you can see that most of the deaths in Washington State have come from the light green line, the King County, Snohomish County line. But the rest of the state is now starting to pick up. How much will it pick up and how long will it take? But I don't know the answer to that. All we can do is start tracing this and say at least in King and Snohomish, it's looking okay. The other thing that was published just this last week is this model for how the epidemic is predicted to take off, play out for the individual states. Again, this model has a lot of assumptions in it. But I don't want to debate whether I think the model is good or not in the future. I want to say, how has this model been in predicting the past? So I want to take this data. You see, this came out on 3/25. And it predicted that there would be a peak at 4/21 of 27.3 deaths. Obviously, it's a prediction. That's how you can have a fractional death, right? Because it's really a probability of what's going on. And so I went and I took the site from the same day. I took a screenshot of the same site's predictions, and you can see that it follows those predictions. They actually said they predicted the peak would be April 16 because the peak is actually spread out in this prediction from April 16 to April 21. But all that's to say, when this happened, I went back and I plotted the death data day by day on top of this, and you can see that we get those little blue lines on top of it, the little blue dots. And the blue dots, some of them are above the predicted dotted line, some of them are below it. That's what you expect from the noisy data. The noisiness from early on has continued. But if you look at where they are, they're not all above the line. They're not all below the line either. In fact, it looks like that line prediction was actually pretty good. And so the good news is, for those who are wondering whether this IHME model was too conservative, that it was leaving out the chances of some kind of surge showing up, we haven't seen any evidence of that. And we have followed it. And in fact, they update their mortality predictions day by day. And so I've gone and I've taken a screenshot from just yesterday, and I've overlaid it on top of this. The other thing I had to do is I had to readjust the y-axis, because the prediction itself, given the data that's come in, has gone down. You can see the data's noisy, just like what I plotted out. It looks like we're using similar sources for the mortality data that we're plotting on top of the graph. But notice when I flip back and forth, this was the prediction on 3/25. This is the prediction yesterday, and notice that the red dotted line is lower. We seem to be undershooting the prediction, if anything. And also that shows up when they show the predicted days to the peak deaths. You had 18 days on 3/25. Now you have 6 days from yesterday. This means that if we continue to follow this model, we might be able to undershoot what was looking like the prediction was just a week ago. The peak is now predicted for April 9th. In my experience, this might continue to move forward by a couple days. And by the time I do the next one of these, maybe we will actually see the peak. I can hope, It's good news to have a model that it looks like it was a little too pessimistic when it comes to this. Not terribly pessimistic, and in fact still within the range of uncertainty. And this data goes up a lot. There's nothing forcing the data to follow this model. But I can say the model looks like it's been pretty good since March 25th. And to stand here after about 2 weeks and say that, that's about as good as I could expect. I want to remind you of this. This was actually on one of my earlier data updates. And it's about the predictions that took place in early March for what would happen if we did different levels of contact reduction, which means different levels of social distancing, working from home. And back then, they were hoping that we would follow the line, the green line, with 50% contact reduction. And so looking at this data, if you look at all three kinds of data, they've all sort of flattened out. Hospitals up a little, deaths and cases down a little, but still mostly flat. That looks to me like we have actually done what I was hoping we would do when I first presented this graph, is what it looks like we're following the green line. What we're worried about is it suddenly turning around and having some kind of surge that happens. If you have the blue line, business as usual, you will have that surge come back. All I can say is what's in the past, we have not seen a surge yet. And if we have followed this line successfully, if this line has been successful in predicting the past 4 weeks, then I think that we can say that there's probably not a surge ahead for the next week. If we continue on this contact reduction line, which means maintaining current practices and keeping an eye on the data. So at the end of the day, I want to remind us of what we said before. and what we said would be success. Let's not move the goalposts. Let's not try to be too optimistic or too pessimistic about what it takes to control this epidemic. We want to look at the data and say which models served us right in the past. Maybe we should trust those models for the future. And remember that the whole question all along, this was a plague, an epidemic that's scary on the mortality front. But what is really scary is the hospital load, the clinical care crisis. Remember that if that is what we want to prioritize, that has to be our first priority. We aren't going to be able to eliminate death or eliminate this virus like the polio virus, at least for another couple years. We have to be thinking about this as far as how can we manage this? How can we manage the risk? One, the most important part of that is not overloading our hospitals. And so with that Snohomish data in mind, where it's going up slightly, you want to avoid a surge. It looks like we're doing that. But everyone's wanting to be careful about not saying this too loudly, because if we've avoided the surge by social distancing, then we can't suddenly just say, okay, we'll just go back to normal. We'll stop social distancing, and then we'll be following that blue line, and then we'll have the peak come up again. So, but at the same time, I do want to say this is an accomplishment. We have followed a particular line, and we can say we are actually doing okay in Washington State to the extent to where we can look at the other places and we can say these places really need help. There's like a huge natural disaster going on in New York City right now, and they're going to take some time to recover from that. The good news is not every area is following those lines. And so we need to think about reasonable community practices, keeping up the distancing. Making a mask is now the recommendation, and so we're going to try to make that mask ourselves to help the distancing efforts and to wear them outside. I have a bunch of complicated thoughts about the masks, but basically the upshot of it is do it. It's not necessarily for protecting you, but it's for you protecting others. And isn't that what's really important, right? So the last thing I want to say is I want to again say I know that we're making some antibodies to this. I don't know how many or how effective they are. And so let's test for it. Let's see how many infections have our immune systems already prevented. So that means surveying the population with antibody tests. The one thing I want to mention about these are just starting to come out now. And just like with all these data, you've got to collect a week of data. You can't go by one study, one area, one test. You've got to survey a population, and one of the issues of these is they're 95% effective. That sounds great. The only thing is if you're applying that to thousands, hundreds of thousands of people, 95% effective means it's not effective for a large number of people as a result. And if you have low numbers of infections, you can actually have more false negatives than you have actual positives. So all that's to say, wait for the data. You've got to be patient to come to this, but they're starting to come in now. And honestly, so far, they've been all over the place. I've heard some really bad news and some really good news, and we've got to collect more data on this. Again, like I said, I don't know if 1% or 20% of the population has been infected. The antibody tests will tell us. And how we move forward should depend on that. So let's wait for the tests to come in, and let's make our decisions based on those data. If you're looking for how to make your own mask, I want to recommend the smartairfilters.com article about it. It's about what they actually tested to see what different materials of homemade masks worked against different infections. So if you want to base what you're doing on data, here's data right here. At the end of the day, do something, because that's much better than doing nothing. And one last thought about this. The reason why masks are good is not because they will completely catch every virus, but they might reduce the viral load. And the viral dose matters. How many viruses you challenge your body with at a certain time. Your body can handle a small amount of virus. Even if it's this coronavirus that you're so scared of, your body can handle a small dose of it much easier than it can handle a big dose. You can imagine like, the scene of Helm's Deep in Lord of the Rings, right? You have this huge army that's attacking the stronghold, the Hornburg, right? And you have the thing about that army is it's so big, on a case-by-case basis, it looks like the soldiers at Helm's Deep are probably better than the orcs on average. But it's just the overwhelming numbers of the orcs. The virus is like the orcs, okay? And the good news is if you are not in a Helm's Deep situation, somebody on the front lines, a doctor, is in a Helm's Deep situation where they've got all this virus being challenged at them all day. But somebody who's going shopping in a grocery store, you're not at Helm's Deep. You're at the case where the Fellowship was attacked by the orcs when they were going along the river Anduin at the end of the Fellowship. And if you don't know what that means, you're at the end of the first movie. You're not in the middle of the second movie. Let's say it that way. All that is to say, you can handle a small amount of virus, and it's very possible that your immune system, again, if you're not immunocompromised and you know how to take reasonable precautions if you are. But there's a lot of good that our immune system does that we don't even know about. This is something that scientists know intuitively, and I was kind of surprised to find out how many people don't really know about this. That if you are challenged by a small amount of the SARS-CoV-2 virus, you can probably take care of it. And so that's why you shouldn't be that concerned about opening your mail. Take precautions if it makes you feel better. But you need to avoid a panicked overreaction to low-dose exposures. Don't take my word for it. Here's an article in the New York Times that basically says this. Take precautions like wearing masks, spacing yourself out. You cannot eliminate exposure, but the good news is you don't have to. You just have to get the exposure down to a level where your immune system can take care of it. And your immune system can protect someone else whose immune system might not be as up to the job. You can reduce risk. You cannot eliminate it. We're not going to be able to eliminate this virus, but we can reduce its risk. And I want to look at the data to say, what should we worry about? We should worry about our frontline responders. We should worry about their having enough PPE. We shouldn't worry as much about going to the grocery store or breathing in the air, or if somebody's riding their bike past us and they come within 5.5 feet rather than 6 feet. Probably you're going to be okay. Life is risk. It's like that quote from The Princess Bride. Life is pain, Highness. Anyone who tells you different is selling something. So I'm not going to tell you life's not risk. In fact, be suspicious of anyone who's saying that we can eliminate the risk from this. We're living in a new world that has a lot of risk. But the good news is we have some invisible help on our side. If you're a scientist, you can point to the immune system. If you're a believer, you can point to the creator of the universe. So with that in mind, as I knew this would always go too long, but I wanted to give you a 28 days later reaction, and this is much sunnier than the movie 28 Days Later, which I don't recommend you watch right now because we all have enough worry right now. You don't need to worry about that stuff type happening. The thing that's happened in 28 Days Later is we've had the abandoned public spaces. But that is more of an abandonment of rest. It's not an abandonment of fear. We don't have to have a spirit of the fear of this virus as long as we respect it, take the precautions, and we protect those who are most vulnerable. It's very possible if you're listening to this, you can have a duty to protect someone else rather than to be fearful for yourself. Be afraid for taking care of others and trust that there are some good things in the world that can balance out the bad things. There's some good in the world. There's Tolkien quotes about that as well. But I'll spare you those because those are already all over the internet. All right, keep distancing. We'll keep an eye on the data. Hopefully in another half a week or a week, I'll be able to check in. And hopefully, again, maybe I'll have 3 pieces of good news instead of 2 good, 1 bad. We'll see. I'll just have to take the data as it comes. Until then, take care of yourself. And for those who are praying types, please keep praying.